everybody, and welcome back to another episode of Healthtech Pigeon podcast, dissecting and discussing the latest health tech news every single week, so you don't have to. I'm Amy, and with me today, I'm joined by SomX's Huw. Hello, Huw. And Adama on producer duties. Thanks, Adama, as always. And we are delighted today to be joined by Katie Baker, who heads up operations at Tandem Health. Katie has an incredibly impressive and interesting background and career with experience as a CEO, a practicing clinician for 10 plus years, co-founder, international speaker, and experience across the health tech sector. So Katie, a very, very warm welcome to the podcast. Today we're going to be chatting about AI scribes and recent news and all of that fun stuff. But before we get into those stories, Katie, do you want to tell us a little bit about you and your background, fascinating, interesting background, and what you do at Tandem for our listeners? Thank you.
Yeah, of course. So kind of I guess the short story is NHS GP by background, and I've kind of worked across 6 different health tech businesses across the UK, EU, and the US in all kinds of different varying roles. But currently, I'm director of UK and Ireland for Tandem Health, which is originally a Swedish company focused on AI scribe, and brought that to market only 6 months ago, but it's had rapid growth in the UK market.
Awesome. And I suppose leading nicely on from that, then we can get into the juicy details. Although I haven't asked Huw how he is today, so I feel like we've skipped that out. Huw, are you okay?
I'm fine. I'm very conscious that I've lost the stories from my web browser, so just digging those up while Katie was talking. What I will say is, if it feels like we are going all out on Tandem this week in Pigeon, it is purely coincidence. But Katie, your Health Tech podcast went out this week as well, so you're going out to everyone en masse this week. But pure coincidence, I promise.
I didn't even know. I was getting some nice LinkedIn messages actually, and I was just like, "Oh, I must be somewhere." So yeah, pure coincidence. But great. It was actually very difficult not to mention some of the news on that podcast, which was recorded literally a few days ago. So
Oh
yeah,
wow!
yeah.
For everyone who listened to the Health Tech Pigeon, this is almost like a little follow up. So we can dig into the news today. Well, in the spirit of Tandem, then, continuing this train, the great, exciting news this week about Accurx and Tandem Health rolling out a new AI scribing tool across the NHS. So, Accurx and Tandem Health have launched Accurx. Am I pronouncing that right? Accurx. It's quite a hard word to say, isn't it? Uh, Accurx Scribe across the NHS. And Katie will be able to explain this much better than I will. So I will hand over to you in just a moment. But essentially, the tool transcribes and summarizes and codes patient consultations into clinical records. That can generate referral letters and advice and guidance requests as well. It's rolled out from the 29th, so I guess it's live, and Katie can speak to that too. And the big part of the story is that obviously the partnership with Accurx, which is used by 98% of GP practices already, means that it can be rolled out very, very widely. I assume very quickly. But yes, Katie, do tell us in your own words, please. What's the news? How are you feeling about it? And yeah, why are we excited?
Yeah, well, thank you so much. Well, it's to be honest, it's still a bit surreal. I still remember the first time I actually pitched to Jacob and Eden at Accurx to talk to them about Tandem, and that's kind of how we got into talking about this RFP that they put out for. I think they looked at 6 different scribes in the market to really be their go-to-market partner for the NHS, given their trust in the communication space across, I think it's 98% of primary care and 77% of secondary care. And from the kind of the meeting of both companies, we were very, very aligned. Firstly, on like how we thought about technology in the health system in the UK, and also how we needed to get kind of feedback from those on the ground to build the best product possible. So it was kind of a great meeting of minds, and the teams have worked super hard to release Accurx Scribe powered by Tandem. And what that means is that the Tandem Scribe will be available on the Accurx toolbar, which sits across most people's desktops. Obviously, after going through the right compliance pieces, with which we're working very hard on at the moment, um, and yeah, will be available to all of those clinicians with the aim to really improve. I think it's Jacob was saying it's a third of time is now spent on admin across all of those sectors. So really trying to support healthcare staff. So that's kind of where we're excited. And for me, it's like a big personal mission is trying to improve healthcare for particularly for the NHS because I'm so passionate about it. So absolutely delighted that this has come together and excited to learn from people who are using it and work together to make it the best it can be.
That's great. I mean, I've got a couple questions. I'm sure Hugh might as well. I'm quite interested about. I mean, obviously you've had a lot of experience across the health tech sector and now in an operations role. Uh, from an operations perspective, what was that lead up to this partnership like? I suppose the rollout part is interesting here. Obviously, you're integrating with an already existing partner within the NHS. So could you tell us a little bit more about that operations and that integration and how I guess how you set out to essentially kind of get over those barriers that you might have seen and sort of integrating those processes?
So yeah, I think I mentioned we kind of only came into the UK market, I think it was just over 6 months ago now, but obviously we're built out of Sweden. And I guess that gave us, as Tandem, quite a bit of an advantage in the sense that the Swedish system is very highly regulated, very fragmented. They need a lot of kind of templating. And the solution really had to be built with clinicians to be able to scale across different specialities, different regions, etc., which kind of set us up from a product perspective and an integration perspective quite well from the beginning. Um, Obviously, then when we came into the market, we started to get customers very quickly. So we learned and adapted, kind of talked to clinicians and patients about what they wanted. And then as we started to work more with Accurx, who obviously have this huge impact on communication across the system, it became very apparent how we could transform the system by putting those two solutions together. Um, Looking all the way from digital triage all the way through then to like primary care communications to secondary care and back, and that vision of what we could create. And actually, with the toolbar as it is from Accurx, which has again been built very well, is like people love that. The ability to be able to put the scribe in there that then opens up Tandem, which we knew worked really well from kind of, I think we're in about 10 different geographies and have kind of tested heavily with people on usability, interoperability, etc. It was kind of, I'm not going to say it's easy because the engineers listening to this who have worked really, really hard for kind of, I think it's 2 months, at 6 to 8 weeks on the integration itself. Um, but they worked so well together that it was kind of a very nice match. But obviously, there's been additional things from an operational perspective going on in the background, such as updating all the compliance and regulatory pieces that we need to go out to the NHS with, bringing the teams together, training the teams up from a customer support perspective, going into practices together to get feedback on the new product. It's been a whole whirlwind, but it's been really enjoyable. And the best bit has been with the like speaking to the clinicians, and particularly at the conference that's on Tuesday, where we got to speak to people who'd used both solutions
Mm.
as well.
You mentioned the regulations there, and we're actually going to come on to a story and talk a
Yes.
little bit more about that later. But was that the main challenge? Was that the hardest bit? What was the hardest bit about integrating this?
What was the hardest bit? Um, Again, it's probably a technical question that I'm sure there have been many difficulties. To be honest, it was trying to preserve the functionality that Tandem had and figure out how we put that in a safe way through the Accurx toolbar for clinicians to use. And some of that is kind of we're doing in a phased approach. So um, for example, a big thing that comes up is like, can we use this on telephone? And in the Tandem standalone app, you can use it kind of if you're taking telephone calls anywhere. And that part is being phased to come in, I think, within the next few weeks with Accurx. There's been some, more technical pieces that have been more tricky to bring together. Um, Compliance actually wasn't so much because both teams have got, I mean, I'm speaking from a bias, but from Tandem, but very strong clinical safety team Accurx have multiple clinical safety officers, so bringing our two pieces of documentation together was very easy because of like the high bar we have on in that area. Um, and the teams have worked really well together. So I probably should have more challenges. It has been challenging, but
Sounds like it's been easy peasy, to be
it
honest.
has
No,
but
I'm
because
sure
the
not.
teams are so wonderful to work with, and I'm not just saying this, it's made it seem easy where it's been, I'm sure, very stressful on both sides.
Yeah, jokes aside, I'm sure there were lots of hurdles that you had to overcome, but, yeah, Hugh, have you got any questions you'd like to ask Katie on this?
Yeah, I mean, it's huge news, isn't it? Like this, we talk really often about the challenge of scaling and building businesses in health tech in the NHS and rolling things out. And I cannot imagine a better partnership for someone recently entering the UK market. I mean, it's hard not to talk about sort of other kind of ambient scribe technologies in the round when we're talking about news like this, but it's been very interesting to look at, and I think I saw someone explore this in more depth. But looking at the go to market strategies for a lot of these tools, they're all very different. Like you would
Yeah,
have seen some companies go with that. I'm going to the individual hospitals and scaling from there. We've seen some where it's that kind of from the bottom up, going straight to the clinicians and making the clinicians build it, and then it keep going. And then there's this, which is almost the dream, isn't it? It's the partnering with one of the health tech scale ups of the last 10 years that has such penetration within the NHS that
yeah,
I'm interested to know how it came about, and like what. I mean, I won't make you reveal the secrets of what's next, but is this the overall approach? Is this how it goes? And do you have much left after Accurx? Once you're in places where Accurx is that's surely it.
yeah. Well, I wish it was it. No, I don't wish it was it. There's so much to do. So I think roughly, and don't quote me on these numbers, but I think about 80, is it 85% roughly of the market is public in the UK, and then the rest is private. So we do actually still have a growing private healthcare market at the same time, and have talented people looking at that at the moment. In terms of how, I'll answer your question about how it came about, and then kind of what's next. Um, as I said, well, I've used Accurx myself as an NHS GP. I think that helped a lot to really deeply understand how could this product really help. We were also running, studies across primary care, and had lots of super users in the primary care UK market prior to going into this. And obviously had established ourselves very well in specialty care, particularly across other geographies, and had several differentiators, I would say, in terms of usability, um, like interoperability with EMR systems, which we have a lot of experience in building across Europe as well. Um, so after the pitch, I think it was very much excitement of like, what could we actually build here together? And it was more the teams coming together to say, well, our visions align now on, you start by improving that communication that's happening by using scribes to create structured data, to then really integrate this pattern. Suddenly you're able to start transforming large clinical pathways and healthcare, which without one or the other, I think would be very difficult. It was great that they saw our differentiation as well, and the teams gelled really well. Um, but definitely, this is just the beginning. I think, with any rollout of technology, it's about listening to the people using it. It's thinking about how is this being adopted? How do we support people to do this in the safest way? But we are seeing rapid uptake. I mean, someone sent me a nice graph yesterday from the Accurate team, which was like forecasted waitlist growth, etc. And we're kind of seeing an exponential curve, which is quite exciting. Obviously, we have a very phased, safe kind of approach to the rollout. But I think this could really help across multiple health systems beyond just, it's a kind of 2 + 2 = 5 relationship, with communication, and then administration and structured data. So we'll
Hmm.
share what I can when I can with you.
And given that it's going to, more than 200,000 existing users in GP practices, um, was there anything, eh, how is that being, I guess, communicated to the people that are using it? Is there sort of any, not resistance, but will it take people a bit of time to get used to this kind of technology, or is everyone sort of up for it already?
It's the response in the market has been absolutely incredible, and Hugh touched on this a bit in terms of, like, approach to market. So there's some scribes that we all know that have been in market for several years already, and have had similar kind of hurdles with, sign-offs and things like that to get through. Um, in terms of how we're rolling out, we're doing that in a very slow approach. So originally, the people at the conference, we'd kind of spoken to the ICB levels, ensured that from a compliance perspective, like this was available to be rolled out, and then allowed them to start working with their practices on the compliance documents to be able to switch this on. There'll be then a next phase, which is those full clinics are able to use this. And then the final phase, which comes from June onwards, will be that national rollout. And it's beyond primary care. We're also in community mental health and acute trusts as well. But a lot of the messaging has been around primary care. Um, and obviously, that gives us the time. We're in conversation with pretty much every ICB in the country to ensure that this is rolled out in kind of a compliant way. So we're working with them to do this. This is very exciting.
Yeah.
Great response.
I can see from your face, the smile on your face, that it's like the genuine happiness and excitement about it. And it is because of the scale of it, right? It's, yeah, it feels very positive.
And it's more the like impact we're seeing. So from even from like anonymized feedback, seeing that I think it's 85% of people generally, even if they're not using scribes, see the positive impact this can have on their workload. And then you've got the clinician perspective of, I think, of people who've used scribes, at least 50%, I think that this will improve accuracy of notes, and kind of improve their work-life balance, which is just such a big thing, particularly for me, having lived it. It just is probably part of the reason I went into health tech, to not, 5 day a week as a GP is really tough. And I like commend the people doing it, because it's, yeah, really, really hard. Um, but yeah, it's an exciting time.
It's really interesting to hear that like that pulled out as a strand, and I'm saying this in a very positive way. But
Yeah.
I mean, the work life balance piece, it just taps into the what can AI do for clinicians, and there's a lot of how, yeah, we see so many companies where it's like, oh yeah, give clinicians more time, but with more time back from each consultation, so that they can put it to the see more patients thing.
No.
Sometimes you just need a break.
Yeah, and there are some places where that may work, but really there's so many more advantages than that in terms of, as you said, like the biggest thing we hit back is mental load. I think I've said this before, of just the clinicians. I mean, I remember seeing it was minimum 14, if not, you can now see up to 24 patients. And if you're not able to document anything, you're trying to remember those things, trying to remember the plans. Um, and this goes beyond, we talk about GPs, we talk about things like that, but this stretches across specialties. This is for nurses, this is for physios, this is for admin team members as well. And what's really exciting is how I think we'll see with Accurx Mobile coming through as well, the ability to now do this. There were so many technological difficulties going to home visits, like doing pieces where your laptop wouldn't connect to the internet. And suddenly you've got this tool where you can decrease admin, and fit into workflows much more easily with technology. And it's pretty exciting, I think. I know I'm biased, so
No, that I think we can safely say that it is an exciting moment, for health tech. So, well, I think this leads quite nicely on to digging into a little more about adoption, regulations, and onto our next story. The next story is related, and actually, the timing interesting, I suppose, in combination with this as well. But perhaps you can speak more to that, Katie. NHS England has launched new guidance on specifically on the adoption of voice technology in the NHS. So a key part of the framework covers a series of considerations, posing questions to clarify the product functions, outputs for transcription, outputs for downstream tasks, as well as data and system considerations. There's also quite an interesting questions raised around how the product will be classified, whether it's a medical device or not, and that line, and how we regulate that. So yeah, Katie. really, really interested to hear from you. What does this new updated guidance mean um, for, well, for Tandem and for other AI scribes? And what do you think are the key points to talk about?
Yeah, so I think the updated guidance has probably come from the update from the MDR, which happened about 4 weeks ago. And that was talking about functionality more for mental health tools, and how we think about summarization is one of the key points, and whether that fits into kind of a high functionality category for medical device. It's been, to be honest, it's been an absolutely fascinating journey. I I don't think I can even count on two hands how many regulatory companies I've spoken to since launching this product, and how the kind of views have changed on what this is. Um, but I think the NHS guidance is very helpful, something that obviously we are going to be complying with, and kind of comply above, which I can talk a bit more about. But is also wasn't. I mean, I hope I can say this without getting too much backlash. Was also quite confusing. So we had several regulatory companies like look at it and be like, yeah, like admin tools that are doing this and are being checked by a professional, they're not medical devices. And other people falling on the side of, okay, if you're doing, let's say we were to summarize EHR records and pull that in, then that's clearly a medical device. And the middle is still grey. And in terms of where Tandem's product functionality specifically sits is still in line with MDR from going through that. But our aim with the NHS guidance, just because that's that bit more of kind of summarization, kind of not so much clarity around that point, is that we are actively working with the MDR to ensure that we fully comply with all regulatory guidance from the medical device perspective. It's also interesting because I think it shows us where things are going, and I think certainly there'll be modules that we bring out together that are medical device category, and that's what we're currently working on as well. So it's an exciting time, and I think I have a love-hate relationship with regulations after doing it as one of my jobs in another tech company. But I think regulations are always good in the sense that they give structure to companies that could have, um, outcomes, and it kind of holds companies to a certain level of accountability, which I think is really positive, particularly in healthcare.
And I suppose for the Accurx and Tandem News,
Mhm.
this kind of guidance, I presume, will be very helpful given that the scale that this is kind of rolling out to. And you mentioned obviously that
Absolutely.
phased sort of rollout, and that each site, each ICB might have to go through that compliance. So
Yes.
I would imagine that this guidance will actually support that in a more well, I don't know. Will it speed that process up? Will it make it easier?
Well, I think, oh, well, will it make it easier? Probably not, because the compliance is actually quite tricky. If we talk about primary care, there's multiple documents that you need to do. So if you think about data processing agreement, DPIA, there's DCBs. So we've got all of those updated in terms of rolling out. And then in terms of medical device categorization, I think as well, both teams, Accurx and Tandem, are committed to kind of going above and beyond guidance in terms of clinical safety, evidence generation, etc. So um, it's I think it's helpful, but it's not helpful sometimes when it creates kind of it's not clear to the population what it actually means. And when you have regulatory professionals and legal professionals being like, I don't know what this second part really means, um, that's interesting. But yes, certainly something we're going to adhere to in order to roll out, with safety to all of our clients.
Yeah, if the regulators can't understand the regulations, I'm not kind of sure what waters we'll be in. Hugh, any thoughts on this? Regulations, guidance?
Yeah, well, it's really interesting, isn't it? Because, I mean, what you were saying, like, obviously, you're going out with Accurx. That's the news this week. But I mean, you mentioned already having the kind of the users, the kind of, I guess, that bottom up model as well, a little bit going on. And obviously, we've seen others in the market doing something similar. And whenever I've kind of been following the kind of rollout of the different scribes going different models, and it's particularly that bottom up of individual clinician, individual user, individual even practice takes it on and says, "Okay, yeah, we're going to use it." You do sort of wonder whether is this the wild west of ambient scribe side, like before all of this guidance comes on, where when there's nothing explicit out there, and it's you as you touched on it yourself, which is that is it a medical device? Is it not a medical device? Oh, what it, and I so, my sorry, I'm going to stop stuttering now. I guess my instinct is to say that there's a lot of people out there who obviously want to use it, want to take it on, want to like dive onto it, even when those questions are still going. But I'd be also very interested to hear, and this may not be a question anyone's able to answer. It's probably one I'd love to kind of chat to you in a few weeks after after all of this comes out and get a sense of it. But is this, is there the kind of quiet group of people who are like, actually, do you know what? I'm not going to touch any of these tools until I know what questions to ask. I don't have time to talk to suppliers and find out whether, like, I don't know, I wouldn't know where to start when the supplier says, "Do you want to use my Ambient scribe?" And I'm like, I don't know. Is it compliant? Is it medical advice? I don't know what questions to ask. I don't know what frameworks they need to meet. I don't know what interesting questions this raises. So I'm gonna not touch this. I'm interested. Like, I'd love to know whether this guidance is actually going to be quite useful to opening up the market. For yeah,
I actually agree. I think it is because there's different guidance on the NHS website, including for CIOs and then separate guidance. And I think it kind of mirrors exactly what we've been putting out as a checklist. So, we know that healthcare staff are really pushed for time. Often, like individual adopters, you'll have seen with some other scribes who kind of just push it through a D2C route, don't really understand what they need to do. And so our aim is to help educate and guide people through that. So we actually have a team who help provide like the DCB 0160, like help them through understanding what documents do you need to safely deploy this technology. And that kind of mirrors, it's almost like a checklist in terms of what we're seeing with the NHS guidance, in terms of CSO, the documentation you need, what you need to have checked to make sure this comes out safely. So I think absolutely this will help. Um, in terms of people that don't, I think there's two levels. There's the people you speak about, which is where we can help with the kind of checklist and everything, and they always have their DPO and their ICB to fall back on. And so what we're doing is working very closely with those people in terms of the new NHS guidance in line with MDR and the more specific NHS documentation to ensure that's all in place for a safe rollout across and switching on across ICBs. So I think the companies have to take that responsibility as well. It does make me smile though, because there's so many, like there's let's say large EMR companies distributed across with no DCB. There's no, they're rolled out without any of this documentation. But I still think it's a positive thing that, particularly with AI, this is coming under more scrutiny, and something we're very happy to kind of go above and beyond to help practices with.
it's a challenge there, isn't it? So you mentioned the large EMR companies rolling it out, and it's sort of the smaller companies, the innovative ones bringing in a new technology or kind of pushing it. The response is so often going to be, "I don't know you. I don't know what you want to bring me." Whereas, oh, if it just pops up in EMIS, sure, I can use it. Yeah, it's fine. Why EMIS wouldn't give me something I can't use?
That's a big discussion. We could spend many an hour on this. And I also know the EMIS team, and they're a fantastic team. I think, though, that what people, there's a difference between bringing technology, like rolling out technology, but it really fitting with what healthcare professionals and patients need. And I think one thing that Accurx does really well and is mirrored in the Tandem team is like sitting with those people and spending a lot of time on making sure this actually adds value. And I think that's where the differentiator is against some of the larger companies. So I'm sure we'll see them partnering with some of the smaller innovative companies to be able to actually create adoption across these areas.
We've talked a lot about the positives around this, which there are many. Uh, perhaps you can't speak to this. I'm not sure, but I'm really interested to hear what you think. I suppose following on from talking about regulations and guidance on safety and data, and even kind of ethical questions around the role of generative AI. What would you see as are there risks, and what are the risks, and are there things that we should be considering that as a priority?
I mean, there definitely are risks. I think it's with this technology. I'm part of a like global AI, responsible AI group, which kind of spend most of the time looking at the like high level risks from ethics, bias, and safety, and then also the impact it has on society of rolling this out. And so I think when you look across the categories, you need mechanisms in place to really assess what those risks are and how you're mitigating those. I think as we think about this rollout, like the biggest things are obviously safety. We're in healthcare, like we can't behave like a just any AI company going out there. And so um, it's about having people on the team who take that seriously and work with the people using it to ensure it's as safe as it can possibly be. And where you can't mitigate for some of those things, that staff are trained properly, you have proper onboarding, and you have things put in place to mitigate. Because I don't think there will ever be a perfect solution, to be honest. So there will always be risk associated. The question for me is always, does the risk outweigh the benefit of this technology? And at this point, if it's deployed in the right way, the answer is very clearly no. Like the risk does not outweigh it as long as it's done in the proper way. But I think I could talk about this for hours, talking about how AI can change critical thinking, how it can change, interact. We're already seeing how it's changing interactions, and we're actually looking at it. So we're seeing that clinicians are able to have deeper interactions with their patients. We're seeing patients come out with higher kind of satisfaction from feeling listened to. We're seeing, as we spoke about, Huw, like the burnout rates, looking at how stress levels of clinicians pre and post scribe. We're already seeing the impact, but you're absolutely right, Amy. I think there are, like, in order for this to be successful, I think, and I think this is what's so powerful about a team that's heavily clinician led, is that you have a responsibility to like make sure that the risks do not outweigh the benefits of rolling this out in healthcare. I think that's what's so powerful. But lots of work to do there, and continuous as we see the developments come through.
Yeah, really, really interesting stuff. Katie, thank you so much for your thoughts on that. I think we've got time to perhaps touch on one final story before the end of the episode, just to get us out of the AI scribe. Although very interesting and lots to discuss, just to add a bit of variety for this episode. But actually, the next story links quite nicely with some of those ideas we just discussed around ethics and equity and risks as well. So on
If you have been holding on for 38 minutes for the hope that we move on from ambient scribes, well, congratulations.
It's coming.
the time has
Yeah.
come.
Move on.
The time has finally come to move on. Yes, so on to the next story. Next story is around digital health technologies addressing multimorbidity. So, a new study has revealed that patients with multiple chronic conditions would need numerous digital health technologies, potentially creating additional burdens for these patients, but we shall discuss. Um, Obviously, rapid proliferation of digital health tech in many different conditions and for many different areas of disease. We all know that. We talk about it every week on this podcast. However, this is really interesting that this study is actually looking at challenges for those patients that are experiencing multiple conditions at the same time, and what would that look like for them accessing a digital technology for, let's say, having five or more chronic conditions. So interestingly, they determined that a hypothetical patient would need to be prescribed up to 13 apps and 7 devices, apparently, including a blood pressure monitor, a smartwatch, a pulse oximeter, and to benefit from 28 functions that most health professionals consider important. So yeah, I'm quite interested to hear Katie and Hugh's thoughts really on what do we think about this, and what does this mean for, you know, us talking about obviously digital health and the benefits. Is there a bit of a gap here we're missing? And considering that multimorbidity is obviously something that we desperately need to consider in this. Katie, over to you.
Well, I think I mean, we can talk about multimorbidity, but I think this occurs across multiple like verticals in health tech anyway, of this fragmentation of point solutions, and like how do we make them useful for people without overburdening either the supplier or the kind of end customer with multiple applications. And you see it certainly in the kind of B2B health tech environment of, suddenly people are trying to choose from like thousands of these apps. Um, I think the focus should really be on kind of the patient themselves. And are there ways that we could create a more platformed, integrated approach to link, top kind of top conditions together? Because really, we should be taking the burden away. And actually, if you're adding, did you say 13? Like 13
Apparently so. I
apps.
mean, I think I worry about people's
I,
storage on their phone. I don't think, I mean, my phone would run out of storage.
Exactly. I mean, there's storage and there's also like people managing these conditions are already like the amount of time they must spend and the impact upon their like health related quality of life must be so significant that to add another 13 apps on their to-do list just doesn't seem feasible. So certainly I haven't thought about this in any details. It's just the top of my head thinking, but I certainly think we need more of like a federational platform based approach to bring these together. Even if we think about just the top five kind of comorbidities that people you can think about patterns and which ones often apply across. I'm sure there are some apps who are doing, for diabetes, they'll also be looking at hypertension and kidney disease, for example. But we should certainly be looking at it if we're not already. I'm sure there will be companies out there. um, but it's an interesting question. I'm going to hand over
Mm.
to you, Hugh, and see if
Yeah, Hugh, thoughts?
I mean, I've, it's extraordinary, isn't it? It's 13 apps. I mean, if we look at the purpose of these apps and what they're out there to do, which is obviously help people manage conditions better, and we've seen digital health companies, we've seen pharma lean into this, I guess, like self management and condition management app piece quite a lot. And what does that lead to? That actually leads to quite often the purpose of those apps is, not just the kind of nudges and interventions, but also the reminders to take your condition specific drugs. It does lean into the pharmaceuticals. And obviously, a key part of that is adherence. Um, and I can't help but think that these hypothetical ideas, this hypothetical patient on using 13 apps or 5 different interventions, you involve an app that's designed to make you take your drugs at a relevant time, with another one that means you need to check your pulse rate or your heart rate or anything, or your blood pressure. It blows it out of the water. Half the point in this is keeping people doing things in a certain relevant way, giving them the nudges, the interventions that they need to make sure that they're adhering to their goals and their management so that they can continue all of this outside of the clinic. They don't have to necessarily get the phone call from the doctor to remind them on these things. They don't have to have those check-ins as often. And if you've got 13 apps and none of them are talking to one another, I mean, at some point, it's got to present a risk at a time. Not just, I mean, the core risk is obviously everyone gets completely overwhelmed and just gives up because, I mean, adherence is the biggest challenge in healthcare, really, isn't it? And to treatment, to drugs, it's one of the most difficult issues with the management of chronic conditions. And if your apps aren't talking to one another and you have to do all of this, at what point do you just say, I can't do this anymore? Can't, I stop doing that. And that really interferes with things. Katie, I'm particularly keen on the idea of the kind of federated approach. Um, there's got to be something out there, and there's got to be someone working on the whole idea of bringing all of these data points together and seeing how one interacts with another. Because I mean, if you've health is so rarely a single health condition is so rarely in isolation.
exactly,
Mhm.
unless you're a child
We,
Mm.
or something.
yeah,
But I know we said we'd moved on from Scribe, and I'm trying not to bring this in, but I think one of the
And
first
we're back.
we're back, but just for a
We're
few
back,
seconds,
people.
but
We led you down a false path,
but
and we're
not
very sorry.
really. I'll try and move on very quickly from it, but just I think the first part is getting the structured data to be able to intervene appropriate with these people, whether it be from a medication adherence, whether it be behavioral. And I think that's where the communication piece also comes in, because actually, this is like you're saying, it's about communication of data, it's about communication to people. And actually, maybe we don't need hundreds or thousands of apps. Maybe we just need a health system which has better communication, better structured data, so we can use the coded data to reach out to people with multiple conditions and combine that communication into what the next steps are across multiple diseases. And like maybe that's the game changer, and that's kind of what we're trying to build. So maybe it's kind of not looking at what we currently have. It's like, what could we do that kind of moves us away from this problem completely? I'm going to stop talking about Scribe now. I'll try my best.
No, we'd secretly love to hear about them. Don't worry. Yeah, it's a really fascinating story, and actually illuminates quite a lot of questions, I think. And as we talk, on this podcast every week and elsewhere in the health tech community about new companies, new apps for more and more conditions, that there's almost that question. Yeah, Hugh, just kind of following up from what you said around what's the sort of end point, and will it just be we're sort of flooded, and how do we bring that together in a kind of in a central place? Or I mean, even reading this, I thought, you know maybe this person just wants to talk to someone about all of these things, rather than having 13 or 14 apps on their phone.
Mhm.
So yeah, some really, really interesting questions there, and hopefully that gets everybody thinking. Any any sort of final closing thoughts that either of you want to shed on this, or tie the this conversation together before we say goodbye?
I knew that it's such a great challenge. Katie, I love your point on the like that we need the health system that looks at it in that way versus this kind of separated everyone putting out their own app and their own condition management. And it really does, without getting into the ultra hard topics in healthcare right now, it really does feel like there are kind of two camps at the moment where I think there's that kind of we are pushing down one of each of those roads.
Mhm.
And like possibly the more we go to that kind of slightly, I mean, Americanized, slightly corporate vision of health, we're seeing a lot more of these apps, like individual apps, come from individual companies managing individual conditions. And then on the other camp, we've got maybe it is just about having that kind of centralized approach, that kind of focused human, bringing everything together piece. And there's no answer to that. And I've taken everything down a very metaphysical road. But
I like it
um,
though. I like it because my
yeah,
thought would be, we always taught medicine is not just a science, it's also an art. And so, how do you like communication and the way that we deal with these things isn't just providing a scientific based app as a solution, it's thinking about the whole person, and can we build a system together that allows us to do that? And I think that can be done if it's done in the right way, with, as we spoke about, ambient scribe and improving communication, ensuring that's deployed in a safe and effective way, working with regulators and the NHS, and then hopefully solving for patients with more complex problems. And because that's going to be one of the biggest problems as we, aging population and these chronic multi-morbid conditions. I think we can utilize improved standardized data communication to improve patient outcomes and financial outcomes for healthcare, which would be incredible. And I genuinely feel like we're on this. We will look back at this stage of healthcare and just be like, wow, we were there at the time when we're going through this like transformative period. And I'm super excited about it.
I hope it goes down that route.
We can only try, Hugh. We can only try.
We can.
Do our best.
Optimism.
I love it. Um, well, thank you both so much. Katie, any signposts from you? Anything you want to point people towards to check out from Tandem or you or your work? How can people contact you?
So I think Tandem's on about tandemhealth.ai, but for anyone in the NHS who's looking for Accurx Scribe, that's on the Accurx homepage, and there's a wait list now live, as I mentioned, for the phased rollout. And for me personally, always happy to chat to people, get feedback. So I'm available on LinkedIn. I can always send the link if needed, but
Amazing.
yeah.
Thanks so much, Katie. I've really enjoyed the discussion today. And thank you, Hugh, for your thoughts, as always. Thank you, everyone, for listening. And you can check out the best stories of the week in our Health Tech Pigeon and Biotech Dodo newsletters. And don't forget to like and subscribe. Thanks, everyone, and we'll see you next time.
Thank you.